Here is a combined summary of the 4 pages. A novel framework for sepsis treatment recommendation, medical decision transformer, MeDT, is proposed to empower clinicians with interpretable and interactive decision support. MeDT addresses the limitations of offline reinforcement learning by incorporating known treatment outcomes, target acuity scores, past treatment decisions, and current and past medical states. This enables the capture of complex dependencies among a patient's medical history, treatment decisions, outcomes, and short-term effects on stability. By conditioning on acuity scores, MeDT addresses sparse reward issues and facilitates clinician-model interactions, enhancing decision-making. Following training, MeDT generates tailored treatment recommendations by conditioning on desired positive outcomes and user-specified short-term stability improvements. The proposed framework is evaluated on the MIMICII dataset using off-policy evaluation, demonstrating competitive performance with existing offline reinforcement learning methods while enabling a more interpretable, personalized, and clinician-directed approach. Unlike RNNs, which struggle with complex and long medical records, transformers effectively model long sequences, enabling learning of better representations for treatment histories. MeDT recommends optimal treatment dosages by auto-regressively modeling a patient's state while conditioning on hindsight returns and one-step look-ahead patient acuity scores. To evaluate the policy's performance, 4 off-policy evaluation methods are utilized: inverse reward estimation, weighted inverse reward estimation, fitted iteration, and world dynamics replication. An autoregressive evaluation pipeline is also proposed, which uses a pre-trained state predictor to simulate treatment trajectories with multiple sequential decisions, providing a more interpretable and transparent evaluation of the policy's performance. The MeDT framework integrates a transformer-based policy with OPE methods and an autoregressive evaluation pipeline to provide a rigorous and robust evaluation of the policy's performance. The medical decision transformer, MeDT, model is formulated as a Markov decision process, MDP, to learn policies using offline reinforcement learning, RL, for clinical decision-making. The model utilizes a transformer architecture to learn policies from a fixed dataset of collected trajectories, each containing selected actions, observed states, and obtained rewards. The input tokens for the policy model encode past treatment decisions and patient states, as well as desired return to goal, RTG, and short-term goals, such as future patient acuity scores or achievement to goal, ATG. MeDT is conditioned on short-term goals, such as future patient acuity scores, to provide additional context for treatment selection. This allows clinicians to input desired acuity scores for the next state, enabling more informative conditioning and guiding the policy's generation of treatment dosages. The SAPS-2 acuity score is used, which considers relatively more physiological variables, providing more informative conditioning. The policy network uses an encoder with a linear layer and normalization layer for each type of input to project raw inputs into token embeddings. Learned position embeddings capture the temporal dynamics of the patient's trajectory. The resultant embeddings are fed into a causal transformer, which auto-regressively predicts the next action tokens. The evaluation loop, algorithm 1, outlines a rollout procedure for generating a sequence of actions by predicting how a patient's state evolves as a result of those actions. The paper employs 3 methods for evaluating policy performance: weighted importance sampling, WIS, weighted doubly robust, WDR, and fitted iteration, FQE. MeDT outperforms other models, with an overall acuity score of 40.31, and performs well across different acuity levels. A transformer interpretability method based on information flow is used to provide insight into MED's decision-making process. This method computes relevance scores to visualize the importance assigned across the input token space. The algorithm adapts to the decoder transformer architecture of MeDT and is used to generate relevancy maps. The experimental settings involve training and evaluating MeDT on a cohort of septic patients from the MIMICII dataset. The proposed medical decision transformer, MeDT, framework is evaluated on the MIMICII dataset, comprising 9% mortality rate patients selected based on the Sepsis 3 definition criteria. The data is pre-processed using a pipeline involving physiological measurements extraction, imputation of missing values using nearest neighbor algorithm, and averaging multiple observations within each 4-hour window. The patient state consists of 5 demographic variables and 38 time-varying continuous variables, with treatment administrations discretized into 5 bins, resulting in a combinatorial action space of 25 possible treatment administrations. MeDT is compared to several baselines, including BCQ, NFQI, DDQN, CQL, a transformer-based BC algorithm, and DT. MeDT differs from DT in that it conditions on acuity to go at each time step. The results show that MeDT outperforms the baselines in terms of stability of estimated patient states, with DT performing better for high-severity patients. MeDT requires more samples to reach convergence, as evidenced by the experiment evaluating sample efficiency. The FQE, WIS, and WDR evaluations demonstrate that MeDT produces the highest estimated values on FQE and WDR, while CQL performs best on WIS. MeDT and DT policies exhibit less variance than the baselines, suggesting they are more robust models. A qualitative analysis of the MeDT policy reveals that it generally aligns with the clinician's treatment strategy, recommending lower doses of IV medications on average. The MeDT policy assigns relatively more importance to certain time steps and components of the attention-based temporal graph when making treatment decisions, facilitating an assessment of its reasonableness. The model's decision process can be further understood by analyzing the relevance assigned to input tokens, enabling clinicians to identify potential errors and understand the model's decision-making process. The authors establish a comprehensive foundation for their work by surveying a diverse range of research papers on transformer interpretability, decision transformers, and offline reinforcement learning, emphasizing the importance of sequence modeling in these domains. They also review research on interpretable reinforcement learning, highlighting the need for transparency and explainability in decision-making processes, particularly in healthcare. In the context of healthcare, they reference studies on reinforcement learning for sepsis treatment, offline policy evaluation, and interpretable off-policy evaluation, as well as works on evaluating reinforcement learning algorithms in observational health settings and guidelines for reinforcement learning in healthcare. The authors also acknowledge research on representation learning, batch policy learning under constraints, and optimizing sequential medical treatments using auto-encoding heuristic search and POMDPs. This comprehensive review underscores the significance of reinforcement learning, transformers, and interpretable models in healthcare, highlighting their potential to improve sepsis treatment and patient outcomes. The authors then introduce a novel transformer-based model, MeDT, for treatment recommendation in sepsis patients, leveraging the MICII dataset and reinforcement learning to predict patient trajectories and recommend treatments based on physiological variables. MeDT improves upon current state-of-the-art models, such as deep treatment, DT, by utilizing multi-step physiological variables as input and predicting patient physiological state post-treatment. The model's reward function incorporates both physiological variables and treatment actions, allowing it to learn from experience and adapt its treatment recommendations accordingly. Evaluation results show that MeDT outperforms DT in terms of physiological variable prediction and treatment recommendation accuracy. The paper also discusses MED's architecture, hyperparameters, and an ablation study, as well as limitations and future work, including potential biases in the dataset and suggestions for enhancing model robustness. The state predictor, visualized in Figure 7, generates patient trajectories based on treatment recommendations from decision trees, DT, and modified decision trees, MeDT, showcasing 6 patient trajectories. Figure 8 presents the train validation performance curve of the state predictor, averaged over 10 seeds, demonstrating its ability to predict patient states. The state space consists of 34 demographic and observational patient variables, listed in Table 2, including Glasgow Coma Scale, heart rate, blood pressure, and laboratory results, which capture the complexities of patient trajectories. Figure 9 compares the performance of MeDT versus DT on scaling from training on 50% to 100% of the train split, averaged over 3 seeds, highlighting MED's robustness in handling varying training data sizes. Table 3 outlines the observations considered for the split SAPS-2 scores, categorized into 7 organ systems, which are used to calculate SAPS-2 scores essential for predicting patient outcomes. An ablation study, presented in Table 4, evaluates the performance of MeDT, DT, and baseline models on patients with ground truth positive and negative trajectories, demonstrating the effectiveness of MeDT in predicting patient outcomes with a slight improvement over DT in baseline models. The state predictor's performance is crucial in the treatment recommendation pipeline, enabling the estimation of patient trajectories following different treatment strategies. The incorporation of demographic and observational variables in the state space allows for a comprehensive understanding of patient states. The ablation study reinforces the importance of the MeDT model in accurately predicting patient outcomes, highlighting its potential in personalized medicine.